Greetings. Let us learn about how do you evaluate acute pancreatitis by looking at the CT scan. So this is very important to manage a patient coming in with acute pancreatitis. So these are my acknowledgements. I want I'm grateful to my mentor, Dr. John Stroline, Mr. Charles Butt, Miss Angela Deal, my institution, and my mentors. Please read this notice. So here is a woman who came in with acute pancreatitis, and she may have excellent recovery if she had just mild interstitial pancreatitis, or may end up being in the hospital with a complicated course if she developed acute severe necrotizing pancreatitis. So how do you differentiate these two forms? And it requires the use of a contrast enhanced CT scan of the pancreas. So let us look at the pancreas anatomy. This is something that we reviewed earlier, how to look at the pancreas. And I would like to make it very simple. When you look at acute pancreatitis, pancreatic injury, think about, is this limited to just the pancreas, or is it extending into the peripancreatic tissue? And when it comes to the type of injury, it may be just inflammation and edema of the pancreas and peripancreatic tissue. And if it is severe with vascular compromise, the pancreas may develop necrosis. So, two main findings. Is there just inflammation and edema, or is there necrosis? Then in every form of pancreatitis, you are going to see liquid collection around the pancreas. And there may be a component of solid collection if there was necrosis. So when you look at the CT, you want to ask, is this just interstitial pancreatitis because of just inflammation with no necrosis and no liquid collection? Or is it necrotizing pancreatitis with liquid collection in the peripancreatic tissue and also necrotic solid collection? So let us look at some CT scans to figure out and understand about these four different components. So here is the pancreas in health, and if the patient comes in with mild interstitial pancreatitis, you may notice inflammation and edema of the pancreas. Here you see that the lobular pattern, lobulation, has been disrupted because of inflammation of the pancreas with edema. As the disease becomes more severe in the next 24 hours, you may notice peripancreatic inflammation and edema. As the patient goes through a severe course, it may take time. The patient may develop acute peripancreatic fluid collection. And this is defined by the presence of just fluid and not solid. And on CT scan, you will notice homogeneous appearance of the fluid. So I want you to keep in mind, think about inflammation, think about necrosis, think about fluid collection or a solid collection in the peripancreatic tissue. Here, the patient developed necrotizing pancreatitis, where you see those dark areas of no perfusion or dead tissue. So here is pancreas with necrosis and edema. And in the first 4 weeks, you may notice not only necrosis of the pancreas, but also necrosis of the peripancreatic tissue. And if the patient develops fluid collection in this setting, it will be acute necrotic fluid collection. In this case, you see fluid as well as solid necrosis. So, interstitial pancreatitis, mild inflammatory pancreatitis, patients get better very quickly, may or may not have any peripancreatic fluid collection. If it is severe, they may develop peripancreatic fluid collection that may get reabsorbed or may develop into pseudocyst. Necrotizing pancreatitis, there is necrosis of the pancreas and peripancreatic tissue and necrotic fluid collection. All these things are happening in the first 4 weeks. And after 4 weeks, if there is interstitial pancreatitis and the fluid gets resorbed completely or may become collection, that is pseudocyst. You define pseudocyst as a fluid collection that is which is walled off with a well-defined wall, and the contents are just fluid, no solid inside that. That is pseudocyst. On the other hand, in necrotizing pancreatitis with necrotic fluid collection, after 4 weeks, it may get walled off, known as walled off necrotic fluid collection, that is identified by the presence of both fluid as well as solid component. So let's step back and look at it. Pancreatitis can be acute interstitial pancreatitis or acute necrotizing pancreatitis. The difference between the two, in the first one there is just inflammation, in the second one there is necrosis. And there may be fluid collection with both, whether it's just fluid collection or fluid plus solid collection. If it is fluid plus solid collection, it is necrotic fluid collection. And after 4 weeks, the fluid collection can get encapsulated and create what we call pseudocyst. After 4 weeks, necrotic fluid collection can become walled off and become walled off necrosis. And the walled off necrosis may get infected. And you identify infection by the presence of gas appearing, as you can see here. And if you put a needle and aspirate, you may see unstaining infection. So I hope this is helpful. And let me just summarize. When you look at a patient with pancreatitis, you ask yourself, is this involving pancreas and peripancreatic tissue also? Is this just inflammation and edema, or is there necrosis? And then you ask, is this just fluid or a solid component? That is in the first 4 weeks. And after 4 weeks, if you see a fluid collection walled off and everything is just fluid with no solid material, that is pseudocyst. When there's a mixture of solid and liquid material, that is walled off necrosis with or without infection. Thank you.